Do you think diabetes is only related to blood sugar? Did you know that your skin can tell you a lot about this condition? If you've ever noticed any areas of skin darker than usual or experienced unexplained itching, then make sure to watch this video until the end. It's quite possible that your body is trying to send an SOS signal about diabetes. Interesting, right? This is also why many people don't realize they have diabetes until their skin tells on them to the doctor. It may sound strange, but there are very clear signs you need to know to protect yourself. In today's video, I'll show you 6 common skin signs that diabetes can cause. Pay close attention because you or someone you care about might need to know this. Ready? Let's go. Sign 1. Dark skin, Acanthosis nigricans. Have you ever noticed an area of your skin suddenly becoming darker around your neck or armpits and wondered why? Don't rush to think you forgot to shower. That could be a signal from your body telling you that your blood sugar is having issues. The phenomenon of dark skin, also known as Acanthosis nigricans, is a condition where dark, velvety patches appear on the skin. These areas usually appear on the neck, armpits, groin, or even on the knuckles of your fingers and toes. Not only are they darker, but they can also be thicker than the surrounding skin. So, why does this happen? According to research from the American Diabetes Association, ADA, this is a sign of insulin resistance, a state where your body can't use insulin effectively. The study has shown that over 90% of those with Acanthosis nigricans are either in the pre-diabetes stage or already have type 2 diabetes. Not only does this affect your health, but dark skin can also make you feel less confident when wearing clothes with open collars or sleeveless outfits. It affects your body's appearance, and this can sometimes lead to feelings of insecurity in daily interactions. Fortunately, this condition can be improved. The best way is to control your blood sugar through a healthy diet, regular exercise, and following your doctor's guidance. Additionally, using skin lightening creams as prescribed can also help improve these areas of skin. But remember, addressing the root cause should always be the top priority. Sign 2. Skin infection. Did you know that our skin is not just a protective layer for the body, but also a health signaling system? When you have diabetes, high blood sugar weakens the immune system, making the skin more vulnerable to bacteria, fungi, and harmful microorganisms. This is when skin infections show up as an uninvited nuisance. The symptoms of skin infections can vary widely from small pimples, painful abscesses, to folliculitis or areas of the skin that are red, swollen, and itchy. Sometimes you may notice small cracks or sores appearing on the soles of your feet, a place where bacteria love to hide. According to the American Diabetes Association, ADA, and many medical studies, skin infections are one of the most common signs in people with diabetes, especially when blood sugar is not well controlled. Research shows that bacteria and fungi thrive in glucose-rich environments, increasing the risk of serious infections. Not only does it affect health, but skin infections also impact appearance, making you feel self-conscious when red or swollen spots are visible on your skin. If not treated promptly, this condition can progress into more serious issues, even threatening your life in cases of widespread infection. To treat skin infections, the first step is to tightly control your blood sugar. It's like turning off the water valve before fixing a leaking pipe. Additionally, keep your skin clean, dry, and avoid irritants. For severe infections, you should immediately see a doctor to get prescribed antibiotics, antifungal medications, or appropriate treatments. And remember, don't experiment with creams or medications without professional guidance. Sign 3. Skin hardening, digital sclerosis. Have you ever felt that your fingers suddenly become stiff and difficult to move, like you're wearing a tight glove that you just can't take off? This isn't the result of typing too much, but it could be a sign of digital sclerosis. Digital sclerosis occurs when the connective tissues under the skin thicken and harden, causing the skin to stretch and become difficult to move. This condition often appears on the fingers, toes, and sometimes even spreads to the hands and forearms. These areas of skin not only become hard, but can also become shiny, almost as if coated with a layer of wax. Research from the Endocrine Society has shown that digital sclerosis is commonly seen in people who have had diabetes for many years, especially when blood sugar is not well controlled. This phenomenon is closely related to the accumulation of collagen under the skin, one of the complications of diabetes that causes damage to blood vessels and nerves. Digital sclerosis not only causes discomfort, but also reduces mobility, significantly affecting daily activities such as writing, gripping objects, or even shaking hands. Aesthetically, the hard, shiny skin can make you feel self-conscious when interacting with others. The most effective solution is to strictly control your blood sugar. Start by building a healthy diet, reducing sugar and starch intake, and replacing them with fiber-rich and protein-packed foods. Also, maintaining a regular exercise routine not only helps improve blood sugar levels, but also boosts blood circulation, supporting the skin and other organs to function better. Physical therapy is a useful method in reducing skin hardening. Stretching exercises specifically designed for the hands and fingers will help improve flexibility, reduce joint stiffness, and maintain mobility. Even gentle yoga moves or therapeutic massage can yield positive results. Additionally, using specialized skincare products is an essential step. Moisturizers containing urea, glycerin, or lactic acid can help soften the skin, reduce hardness, and increase hydration. Sign 4. Brown spots on the shins. Have you ever noticed light brown, round, or oval spots appearing on your shins and wondered, did I bump into something and forget about it? In fact, these are not marks from any kind of impact, but could be a sign of diabetic dermopathy. This condition typically appears on the front of the shins, with small, flat brown spots that are painless and not itchy. Sometimes these signs are mistaken for bruises or minor skin damage, but they are actually caused by damage to the small blood vessels under the skin. According to research from the International Diabetes Federation, IDF, diabetic dermopathy is one of the most common skin complications of diabetes, especially in those who have had the disease for a long time. When blood sugar is not well controlled, small blood vessels become damaged, reducing their ability to supply oxygen and nutrients to the skin. This leads to changes in the color and structure of the skin in the affected areas. Although it doesn't cause pain, these brown spots can affect your appearance, making you feel self-conscious when wearing shorts or skirts. Particularly, their appearance serves as a clear warning that your health needs to be addressed and cared for immediately. So, how can it be treated? The most important step is still to tightly control your blood sugar. Maintain a balanced diet, exercise regularly, and have regular health checkups to ensure your blood sugar levels remain stable. Additionally, taking care of your skin by moisturizing regularly and protecting it from sunlight is also an effective way to help reduce this condition. If you're worried about the brown spots, it's best to consult a dermatologist for further advice. Sign 5. Diabetic blisters. Have you ever wondered why sometimes your skin develops blisters without any clear reason? Especially when you're dealing with diabetes? Let's dive into the phenomenon of diabetic blisters and discover the interesting and sometimes uncomfortable things they bring to your body. As the name suggests, diabetic blisters are large, transparent blisters that suddenly appear on the skin. The strange thing is that they show up without any obvious cause, such as impact or injury, and they usually don't cause immediate pain. Not everyone with diabetes will experience this symptom, but if they do, these blisters can appear on areas like the hands, feet, and particularly the palms and soles. Diabetic blisters look quite similar to burns, but don't worry, they are not caused by sunburn or fire. These blisters are typically large, transparent, and emerge unexpectedly on the skin without warning. You might notice them appearing on the skin without any external trigger, sometimes with no apparent reason at all. This can confuse and worry many people, but don't panic. You'll know what to do once you understand more about this condition. According to studies from reputable medical organizations, diabetic blisters are closely related to poor blood sugar control. A study by the American Diabetes Association found that when blood sugar levels are too high, the body may respond by creating these blisters. The exact cause is still not fully understood, but one theory suggests that high blood sugar can affect small blood vessels and make the skin more vulnerable. This leads to the formation of blisters without external triggers. Research also indicates that these blisters might be linked to nerve and circulatory complications, which are common issues in diabetic patients. Although diabetic blisters are not a serious phenomenon and don't cause immediate pain, they can affect both your health and your appearance. If left untreated, these blisters can burst and lead to infections, allowing bacteria to enter the body. This is particularly dangerous for people with diabetes, as their immune system is often weaker. Additionally, these blisters appearing unexpectedly on the skin can cause aesthetic concerns, especially when they appear in visible areas like the hands and feet. Don't panic if you notice an uninvited blister. The important thing is to control your blood sugar to prevent this condition from recurring. You should check your blood sugar regularly and follow a proper diet. Also, taking care of the blisters properly is crucial. If a blister breaks, you should clean the wound, avoid infection, and apply antibiotic ointment if necessary. In cases where the blister doesn't heal or an infection develops, you should consult a doctor for appropriate treatment. So, next time you see an uninvited blister, don't worry too much. Check your diet, control your blood sugar, and take good care of your skin. In reality, diabetic blisters are not too serious if you pay attention to your health, right? Sign 6. Itchy skin, also known as pruritus, is an uncomfortable sensation that makes you scratch incessantly. It might sound simple, but for people with diabetes, it could be a warning sign of an underlying health issue. When your blood sugar is not well controlled, it can affect your skin, leading to itchiness. Diabetic itching is often not caused by allergies or eczema, but rather as a result of changes in the body due to diabetes. At first, you might experience a sudden itching sensation that could appear anywhere on your body, but it's commonly found on the hands, feet, neck, and abdomen. Your skin may become dry and prone to cracking, especially when your blood sugar levels are high. Not just itching, sometimes the skin can also become red or inflamed, worsening the itching. In some cases, you may even notice rashes or red bumps, making the urge to scratch even harder to resist. Studies from the American Diabetes Association have shown that itchy skin in people with diabetes is closely linked to high blood sugar levels. When blood sugar is unstable, the body can respond by reducing the moisture in the skin, leading to dryness. This makes the skin more vulnerable and prone to itching. Additionally, poor circulation and blocked blood vessels are factors that further exacerbate the itching. Another study from the National Institutes of Health indicates that people with long-standing diabetes are at a higher risk of experiencing itchy skin due to nerve complications and circulatory issues. Itchy skin is not only uncomfortable, but it can also cause health and aesthetic issues. Over time, excessive scratching can damage the skin, lead to infections, or create wounds. This is particularly dangerous for people with diabetes, as their immune system is often weaker, and it takes longer for wounds to heal. Aesthetically, persistent itchy skin can cause the skin to become rough, cracked, and lose its appearance. And as you know, uncomfortable skin can make you self-conscious, and you may avoid wearing short clothes or showing your skin. Don't despair if you experience itchy skin due to diabetes. The best approach is to control your blood sugar levels. Be sure to check your blood sugar regularly and follow a healthy diet to keep your blood sugar stable. Additionally, pay attention to skincare, using moisturizers to keep your skin soft and prevent dryness. If the itching becomes severe or you notice signs of infection, don't hesitate to see a doctor for timely treatment. The doctor may prescribe medications to relieve the itching or treat skin issues related to diabetes. So, next time you feel itchy, check your blood sugar levels and take good care of your skin. Itchy skin may not be a big issue if you have good control, but don't let it become an enemy in your journey to maintain good health. And that's it. We've just gone over 6 skin signs related to diabetes and how to treat them. If you have any questions or want to share your experiences, feel free to leave a question or comment under the video. I'm really looking forward to interacting with you all. If you found the video helpful, don't forget to like, subscribe to the channel, and hit the notification bell so you don't miss the next videos. Thanks for watching, and I'll see you in the next video.